Hello everyone, welcome back to Evidence-Based Medicine with Dr. J. I'll be talking to you regarding atherosclerosis, the process by which arteries get diseased. As a vascular surgeon, atherosclerosis leading to cardiovascular disease makes up majority of my practice. Atherosclerosis is a lifelong process that starts as early as 20 years old, which leads to hardening, narrowing, and/or blockage of your arteries. This can happen throughout the body, which can ultimately lead to heart attack, strokes, limb amputation, or death. Studies have found that nearly over 50% of deaths in the westernized civilization is a result of cardiovascular disease. Also, nearly half Americans aged 45 to 84 have atherosclerosis and don't know about it. In this review, we will outline how atherosclerosis occurs, risk factors associated with it, and how you can prevent it. Before we get to that, do me a favor and quickly hit that like and subscribe button. This will help out my YouTube channel's logarithm and help it grow. Thank you. The process of atherosclerosis is very complex, but I will try to simplify it for you. Let's start off by understanding the basic anatomy of an artery. There are three layers to an artery: intima, media, and adventitia. The intima is the innermost layer which has direct communication with blood flow via the endothelium. Media is made up of smooth muscle cells, elastic tissue, and collagen fibers. Smooth muscle cells are not like your regular muscles, you don't control them. Adventitia is the outer layer of the artery which provides a protection, and it also has blood supply in it for the artery. The term atherosclerosis is of a Greek origin, meaning that thickening of the intimal layer of the artery and accumulation of fat. The atherosclerosis processes can be broken down into three different stages. First one is fatty streak formation, second one is atheroma formation, and third one is finally atherosclerotic plaque formation. Fatty streak formation occurs when the intima layer is violated by offenders. These offenders are lipoprotein particles composed of various proteins, phospholipids, and also lipids such as cholesterol and triglycerides. Worst one of them all is low-density lipoprotein, aka bad cholesterol. Once intima is violated, these lipoproteins accumulate in the intima by binding onto components there. And eventually these become oxidized, but further damage the layer of intima. If you have high levels of these lipoproteins in your blood, then accumulation of lipoprotein occurs in the intima. Your body tries to fight this process by having cells go into the intima layer itself by these cells called monocytes. Once the monocytes enter the intima, they become macrophages, which tend to get rid of the bad cells by literally eating them. Macrophages tries then to leave the intima after eating these oxidized LDLs. However, when they can't, they turn into yellow foam cells. These yellow foam cells accumulate and can be seen as lipid streaks. Fatty streaks form as early as age of 20 years old. I vividly remember a moment in my residency training when I was harvesting organs on a 20-year-old male. This 20-year-old male unfortunately passed away from a motorcycle accident. He was very fit and muscular with no medical problems. However, when we were dissecting out his aorta, there was already evidence of fatty streak formation occurring in him. Next stage of plaque formation is atheroma formation. This occurs when even more cells start joining in the intima, particularly the smooth cells start to migrate from the media on to the lumen side of the plaque. This leads to the formation of more solid plaque with a fibrous cap. Eventually, atherosclerotic plaque formation occurs, which is a final process. In this, additional cells can be found in the core of the lesions, such as lymphocytes, which are your immune cells, calcium, cholesterol, foam cells, lipoprotein, collagen. This process keeps occurring silently until either blood flow decreases to a body part, piece of the plaque comes off and blocks an artery, or a capsule ruptures. When the capsule ruptures, the blood is exposed to all these variant composition of the plaque, and then blood clotting occurs in the artery, causing a complete blockage. Of note, good cholesterol, HDL, tries to help prevent this by removing cholesterol and lipoproteins. However, it is overwhelmed and not able to keep up. There are multiple risk factors that promote and accelerate atherosclerosis. The main medical conditions that have a clear link with atherosclerosis development are high cholesterol, triglycerides, hypertension, and diabetes. High cholesterol and high triglycerides cause your body to have too much lipoproteins, which get into the intima layer, as we discussed. High blood pressure causes damage to endothelium and intima layer, which promotes the lipoproteins to further get into the intima layer. Diabetes causes alteration in your lipid metabolism, leading to more buildup of it. In addition, it causes cellular damage through hyperglycemia and insulin resistance. Cigarette smoking is a major and completely preventable risk factor for cardiovascular disease. Smokers are literally a job insurance for me as a vascular surgeon. It causes damage through lack of oxygen cells, vasoconstriction of arteries, which means narrowing, and damaging the intima layer. The incidence of heart attacks is increased sixfold in women and threefold in men who smoke cigarettes compared to subjects who don't smoke. The risk of heart attacks is proportional to the tobacco consumption in both males and females, and is higher in inhalers versus non-inhalers. Finally, family medical history of early cardiovascular disease is associated with developing artery disease. The risk of artery disease increases if your father or brother was diagnosed with artery disease before the age of 55 and your mother or sister before the age of 65. There are other medical problems too that are associated with development of arterial disease. However, these are much more rare, and the complete list can be found here. Let's discuss some ways how you can prevent artery disease from occurring. The first one is to stop smoking or never pick up smoking to begin with. The incidence of heart attacks is increased sixfold in women and threefold in men who smoke cigarettes compared to subjects who never smoked. The risk of heart attack is proportional to tobacco consumption in both males and females, and is found to be higher in those that are inhalers compared to non-inhalers. The benefits of smoking cessation are seen regardless of how long or how much the patient has previously smoked. Number 2 is diet. There are multiple changes you can make in your diet to help improve your health. There is growing evidence that eating greater fruit and vegetable consumption is inversely related to risk of cardiovascular disease. High blood level concentrations of intralactin, a biomarker of high diet in fiber and vegetables, has been correlated with low risk of heart attacks and with heart disease death. Low fiber intake is also associated with development of hypertension, diabetes, and elevated lipid levels, which, as you already know, are main culprits of artery disease development. Low glycemic index in your diet also further decreases risk. This means eating less processed sugars. Diets containing foods with processed sugars contributes to risk of cardiovascular disease. Low consumption of trans fatty acids. Several observational studies have linked the consumption of trans fatty acids or foods that contain them with adverse cardiovascular outcomes. Number 3 is exercise. Enough can't be said about how good exercise is for you even at moderate levels. It has a protective effect against cardiovascular disease and all-cause death, meaning that it decreases death from all disease processes. Exercise may have a variety of beneficial effects, including elevation in good cholesterol, reduction in blood pressure, less insulin resistance, and weight loss. Men who engage in moderately vigorous sports activity have been reported to have 23% lower risk of death than those who were less active. Persons with mild to moderate levels of physical activity as part of their occupation appear to have low risk of heart disease compared to sedentary workers. Persons with mild to moderate levels of physical activities as part of their occupation appear to have lower risk of heart attack compared to sedentary workers. Fourth is obesity. Obesity leads to development of metabolic syndrome, which is a cluster of metabolic factors including abdominal obesity, high blood pressure, impaired fasting glucose, high triglyceride levels, and low good cholesterol. All these factors are responsible for atherosclerosis development. There's a pattern here of all these different things that you're working on to decrease the main culprits that cause artery disease. One small note about weight loss: patients with more fluctuations in weight loss, such as cycles of weight gain, weight loss, appear to have an increased risk of cardiovascular disease. Finally, there's also a psychosocial factor associated with artery development. It has been shown to be linked with heart attacks as well as sudden heart death. The link between psychologic stress and atherosclerosis may be direct via damage to the endothelium or indirect via aggravation of traditional risk factors, as we mentioned, such as smoking, high blood pressure, and lipid metabolism. So let's quickly summarize the video to give you some quick take-home messages. Main take-home message number 1 is that atherosclerosis occurs from early on, not when you're old. That means you can start reducing your risk of artery disease development from the beginning. Number 2, main risk factors associated with atherosclerosis are smoking, high cholesterol, high triglycerides, diabetes, hypertension, obesity. Number 3, exercise and diet modification is key for you to prevent atherosclerosis and control the medical conditions that were just mentioned. In the next couple of videos, I will talk about how artery disease can present with different clinical situations, which I see in my daily practice. If you learned one new thing from this video, return the favor and press the like and subscribe button, please. This will help this channel grow. Until next time, take care and stay healthy.